हील फाउंडेशन के इस अनोखे ऑनलाइन शो हेल्थ फॉर ऑल में आप सबका हार्दिक अभिनंदन। आज मदर्स डे है। माँ एक छोटा शब्द लेकिन बहुत बड़ा अर्थ। माँ यानी सृष्टिकर्ता, माँ यानी जननी, माँ यानी त्याग और सेवा की प्रतिमूर्ति। माँ की व्याख्या कम पड़ जाएंगे, इसलिए आज के हेल्थ फॉर ऑल कार्यक्रम को हमने महिलाओं को समर्पित किया है। महिलाएं जो खुद से पहले अपने बच्चों और परिवार के स्वास्थ्य की चिंता करती हैं और कभी कभी तो अपनी स्वास्थ्य समस्याओं को नजरअंदाज तक कर देती हैं। आज हम ये पीड़ा उठाएंगे और लोगों को बताएंगे कि स्वस्थ परिवार और स्वस्थ समाज के लिए महिलाओं को स्वस्थ रहना कितना जरूरी है। महिलाओं की सेहत हमारे लिए प्राथमिकता होनी चाहिए। क्या है उनकी समस्याएं और क्या है उन समस्याओं से बचाव और उनका समाधान।
We are on an important day, which is Mother's Day, and on this particular occasion, session 1 will be on exercises for pregnant women.
So it's very important that everybody should exercise during pregnancy. It's a very wrong myth that people in India treat pregnancy as one illness. You should not do this, you should not do that, you're pregnant. But that's absolutely a myth. You should know how to do it when you are pregnant. Okay, so it depends a lot on how active you were before pregnancy. Okay, so your exercise therapy has to be designed according to how you were before pregnancy. So somebody who was already gymming or already running or already swimming, they will have a different exercise protocol than the person who was living a completely sedentary lifestyle. So I always say that if you are planning to conceive, then you should start doing exercises even before the idea of conceiving, because the body will be much more healthy and prepared for pregnancy. Okay, what all exercises I can do in pregnancy? You can actually do anything and everything, including weights. But that depends upon whether you were doing weights before or not. For the first trimester, since the belly has not come up, so the curvature is not a problem. Okay, so what do? You actually do stretching, lot of stretching exercises. Okay, so just to open up your body, because it's easier to exercise in the first trimester. So what you will do, maybe I will just show you. A bow pose is very, very good. So taking the leg as apart as possible, hands at the shoulder level, your right leg facing towards the wall, bend it as you breathe out, you bend it to almost 90 degrees, don't exceed beyond, you come till your toe level, okay? And one straight posture. One straight posture, you can look at your right hand or you can look at the front, but make sure your hand is not going down and up. It's one straight line. So you can do bow pose 1 and you can do reverse bow. So you can actually go like this, trying to open up the chest as much as possible. Keep breathing in and out. And you can even do, so the whole thing happens here also. Now, we are not doing the bow for the pregnancy because again, we don't want to put a lot of pressure here. So this is avoidable for the first trimester. You can very well do this for the second trimester. Okay? For the second trimester, you can do this. Then this, and even going back and taking one leg up. And similarly, you can do Trikonasana, which is basically the triangular pose. Both legs apart, facing forward, breathe in, come up, breathe out, go down, and hold it here for 10 seconds, come back, and then hold it here. Now, of course, your holding can be even more depending on what you want to do, okay?
और अब समय है हमारे चर्चित सेगमेंट योर हेल्थ काउंटर का, जिसका विषय है अस्थमा द इग्नोर्ड एपिडेमिक इन इंडिया। इस विषय पर विस्तार से बातचीत करेंगे डॉक्टर जे.सी. सूरी। डॉक्टर सूरी जाने माने पल्मोनोलॉजिस्ट हैं जो क्रिटिकल केयर और स्लीप मेडिसिन पर अच्छी पकड़ रखते हैं। भारत में फर्स्ट होलिस्टिक पल्मोनरी क्रिटिकल केयर और स्लीप मेडिसिन की स्थापना में उनकी अहम भूमिका रही है। वह भारत में स्लीप मेडिसिन के जनक यानी फादर ऑफ स्लीप मेडिसिन के रूप में भी जाने जाते हैं। और डॉक्टर सूरी से विस्तार से बातचीत करेंगे हील फाउंडेशन के प्रेसिडेंट मिस्टर आर शंकर। मिस्टर शंकर का जर्नलिज्म में 3 दशक से ज्यादा का अनुभव है। वे अब तक हेल्थ राइटर्स के 200 वर्कशॉप और 7 नेशनल हेल्थ राइटर्स एंड एडिटर्स कन्वेंशन का आयोजन पिछले 5 साल में ही कर चुके हैं। मिस्टर शंकर कर्नाटका और केरला से प्रकाशित न्यू इंडियन एक्सप्रेस के रेजिडेंट एडिटर रह चुके हैं और हेल्थ से रिलेटेड टॉपिक पर उनकी बहुत अच्छी पकड़ है।
Why is asthma considered an ignored epidemic?
I think asthma is a very important disease, and you are right that it is an ignored epidemic. Why we consider asthma to be an ignored epidemic? I think to understand that it is important to know the magnitude of the problem. So if you go by the figures, about 300 million people suffer from asthma worldwide, and out of these 30 million are in India. So you can see 10% of the total this thing is seen in India. And the other thing is that this magnitude is constantly increasing. So prevalence almost increases by 50% every 10 years. There are major issues also, like this disease is grossly underdiagnosed and undertreated. So there are issues of getting the right treatment, right diagnosis, right evaluation, so that we are not able to actually make a diagnosis in large percentage of cases because of lack of care, lack of tests like pulmonary function tests. This thing are there. If you see in children, there is a rising number of hospital admission for asthma. Now, what does this indicate? This may indicate that probably the disease is becoming more severe, or there is poor management, or the lack of access to the care, what you can say the effect of poverty. So that is a very important thing. And then, when we are talking of ignored epidemic, as you said, what is the economic impact or the financial burden of asthma? Then you will see, although in developing countries the exact figure is not known, but wherever the data is available in developed countries, you will be surprised to know that about 1 to 2% of their annual health budget it is spent for the management of the asthma. So you can see the importance of this disease. And there was a global initiative, the global initiative on asthma. This was a combined effort by many organizations, including WHO. It was established in 1989, and the main purpose of this GINA was to increase awareness about the prevalence of asthma, how to improve the management of this disease and reduce the burden of asthma in worldwide. And then there is so much of diversity in the healthcare systems all over the world, and the management guidelines needs to be tailored. So there are so many issues related to this, but I fully agree with you that this is an ignored epidemic because the number of patients, the lack of proper diagnosis, and its morbidity and economical impact. All these things point that we need to pay more attention to this disease.
We now move on to session 3, which is on women and wellness.
महिलाओं में एनीमिया पुरुषों की अपेक्षा ज्यादा है। अभी क्या स्थिति है देश की?
So basically जैसे हम सभी जानते हैं कि अनीमिया जो एक प्रॉब्लम है वो रेड ब्लड सेल्स की कमी से हो जाती है, ऑक्सीजन कैरिंग कैपेसिटी जो है बॉडी की वो कम हो जाती है, जिसकी वजह से फटीग, वीकनेस एंड अदर कॉम्प्लिकेशंस, कॉग्निटिव, मोटर डेवलपमेंट फेस करने पड़ते हैं वेरियस एज ग्रुप्स में। सो बहुत सारे नेशनल सर्वेज हैं हमारी कंट्री में जो बताते हैं कि अभी करंटली अनीमिया का क्या कंडीशन है। एंड अगर मैं नेशनल फैमिली हेल्थ सर्वेज की बात करूं जो रिसेंटली रिलीज हुआ है 2019-20 में, जिसमें डेटा में दिखाया गया कि 36 स्टेट्स एंड यूनियन टेरिटरीज को हमारे कवर किया है, तो उसमें प्रेवलेंस ऑफ अनीमिया जो है वो काफ़ी ज़्यादा हाई आई है एज कम्पेयर टू जो प्रीवियस डेटा हमें मिला था अनीमिया का। अगर मैं स्पेसिफिकली बात करूं कि बच्चों के बीच में जो अंडर 5 चिल्ड्रन है उसमें प्रेवलेंस अराउंड 67% है, पहले के मुताबिक 8% तक बढ़ गई है। प्रेग्नेंट औरत की बात करें तो 52% तक अनीमिया हो चुका है, जो पहले से भी बढ़ चुका है। देन हम WRA वुमेन ऑफ रिप्रोडक्टिव एज ग्रुप के बारे में बात करें तो वो भी बढ़ गया है, 57% तक हो गया है। एंड एडोलेसेंट गर्ल ऑल्सो, जिनमें अराउंड 59% तक अनीमिया है। सो बेसिकली अगर नेशनल स्टैटिस्टिक्स को हम देखें और ये जो नेशनल फैमिली हेल्थ सर्वे, सो ये मोर देन 30 ईयर्स से आ रहे हैं हमारे पास सर्वेज, हर डिकेड के बाद आते हैं। अभी 5 साल के बाद ये सर्वे लॉन्च हुआ है जिसमें प्रेवलेंस ऑफ अनीमिया काफ़ी हाई है, सारे बेनिफिशियरी ग्रुप्स मोर देन 50% है। एंड अगर हम एक और सर्वे की बात करें, एक कॉम्प्रिहेंसिव नेशनल न्यूट्रिशन सर्वे CNNS सर्वे आया था 2016-18 का, उसमें केवल बच्चों का प्रेवलेंस अनीमिया का बताया गया था। तो उसमें भी हम देखें तो प्रेवलेंस ऑफ अनीमिया स्पेसिफिकली न्यूट्रिशनल कॉज जो है कि अनीमिया के बहुत सारे कारण होते हैं पर वन ऑफ द कॉज इज न्यूट्रिशनल कॉज, उसमें भी बड़ा हाई प्रेवलेंस बताया गया, अराउंड 67% तक प्रेवलेंस बताया गया था 1 से 4 साल के बच्चों में। उसके बाद 5 से 9 साल के बच्चों में प्रेवलेंस मोर देन 60 था। तो बेसिकली सारे जितने भी हमारे नेशनल सर्वेज हैं उनमें प्रेवलेंस जो है काफ़ी हाई है बेनिफिशियरी ग्रुप्स में। एंड उसी के हिसाब से प्रोग्राम्स और इंटरवेंशंस बनाई गई हैं देन हाउ टू टैकल दिस प्रॉब्लम।
Dr. Sonalika, you mentioned about early pregnancy and late pregnancy.
Yes.
Now, there is a tendency in double income group couples to freeze the egg and have a child at a much later stage.
Yes, sir.
So, does this in any way affect the child physically and psychologically?
Sir, exactly. There are not much complications we have noticed in that, because nowadays the screening tests are very helpful. So we detect it at very early stage as we come to Down syndrome screening, sir, which is a common complication in a late pregnancy, especially with this freezing the eggs and getting it in the fertilization later. So Down syndrome is something which we have seen in these babies, but not very frequently, honestly. So at our 12 weeks, that is in the third month only, we do the Down syndrome screening for the babies. We do the ultrasound, we do the blood test. So that actually gives us a good report that whether the baby is having some kind of mental problem or some. And then after the Down screening comes the quadruple marker test, sir. So these are the screening tests which we regularly perform in all the patients, especially in the late marriages. That is after 30 and 35 years of age when a woman is getting pregnant. So yes, definitely you are right, sir. These late fertilizations and late marriages, these all constitute to the baby growth. It does affect the baby growth, but with regular antenatal visits, with regular checkups, with regular screenings, and with regular medicines and supplementations, these things can be avoided. These things definitely can be avoided.
Some states in India have fared badly in outcomes linked to health, nutrition, and cognitive growth of children in 0 to 6 years of age group based on analysis of public data from 2005-06 and 2015-16. And overall figure is also not very impressive. What's your comment on this?
Yes. So basically, the nutritional status of the pregnant woman and lactating woman, as you state, first 1,000 days are important. And I would rather say that first, before 1,000 days, I will say that the 200 days before conception is also important, and we have to focus on that period, that is preconception period. And during that preconception period, if we work on the attaining the normal PMF for woman who is desiring pregnancy, if we focus on the anemia correction, that is before the conception, If you focus on the as we know that various factors are associated with poor outcome after the pregnancy. Instead of first 1,000 days, I would rather say we have to focus on the first 1,200 days, and in that period we have to give more importance to the nutritional status and of the woman, and we have to focus on the behavior change in doing BCC activities, so we can work on these chronic diseases in that preconception period. And this preconception care model have to be applied at national level, so that we can improve the health condition of the woman who is desiring the pregnancy. And if we work on that, the health and nutritional status of the pregnant woman will improve, and it will affect the then there will be low prevalence of the stillbirth. There will be low prevalence of the under 5 mortality.
कोविड के दौरान पेरेंटिंग के लिए क्या चुनौतियां रही?
जी, पहली चुनौती तो ये थी कि मेरी बेटी पहले से ही स्कूल नहीं जा रही थी, सो उसका सारा जो सोशल इंटरेक्शन था वो फ्री प्ले से ही आता था। तो जब लॉकडाउन हुआ पहली बार, तो पूरे समय उसको घर पे रखना और गेनफुली एंगेज करना, दैट वाज द बिगेस्ट चैलेंज। पहला चैलेंज तो वो था। उस टाइम पे वो 8 साल की थी, तो शी वाज नॉट हैविंग द गैजेट्स। अभी तो सारे बच्चे सब गैजेट से ही चिपके हुए हैं, स्क्रीन टाइम बहुत ज़्यादा बढ़ गया है, बट उस टाइम पे शी डिड नॉट हैव दोज टूल्स टू कीप हरसेल्फ ऑक्यूपाइड। तो हमेशा कोई ना कोई एक्टिविटीज़ इजाद करना जिससे कि वो ऑक्यूपाइड रहे, तो वो चुनौती मेरे लिए थी। दूसरा ये कि she started saying for the first time that she feels lonely. So उन्होंने एक presentation बनाया जिसमें she spoke about 10 reasons why she should get a dog. ये presentation बाद में न्यूयॉर्क टाइम्स में एक्चुअली बाद में पब्लिश हुआ था। चुनौतियाँ तो बहुत सारे हमें फिर ऑनलाइन हॉबीज क्लासेस समर कैंप क्योंकि नहीं हो पा रहे थे। So same challenges as I think every parent in the country and around the world faced at that time, but मेरे ख्याल से mental health of children was a big issue at that time.
What is the most pressing challenge post-COVID, especially in your state, Chhattisgarh?
So we are still dealing with the challenges that a lot of people in the fringes of the forests, they're still unvaccinated. And it is difficult to convince them to get vaccinated, as they are the people who are living in the forest and who do not get convinced. And honestly speaking, there is a huge Naxalite belt in Chhattisgarh where they are asked by the Naxalite leaders to not get vaccinated, and that makes it more difficult to reach out to them. But if you're talking in general about the women's health here post-COVID, then I think the health systems were quite severed at that time. The COVID had shut down everything for the normal people, and then one of the things that we started seeing is that the violence against women, that also shot up, and it was something that now the victims were living with their perpetrators. And it has been difficult, and I would say that it has not only been seen in Chhattisgarh. Within the first week of the pandemic, there were about 92,000 calls on child helpline to seek help. 92,000 reported calls in a first week. So post-COVID, these things which shot up was that suddenly people were finding it difficult to settle down in the new normal.